Welcome to Healing with Her, the podcast where women in medicine share bold and honest conversations from the front lines of healthcare. Step into the world of Black women medical professionals as they unpack the power of healing, the weight of care, and the beauty of showing up whole.
Welcome to Healing with Her, the podcast where women in medicine share bold, honest, and healing conversations from the front lines of healthcare. This podcast was born from a shared truth. Healing is not just about medicine. It's about connection, listening, and leadership. And who better to lead those conversations than women physicians? I'm your host, Dr. Jolie Sosa, OBGYN, and someone who truly believes that taking care of your body is one of the most underrated forms of healthcare, self-care. Today's episode is titled, Summer Feet Are Created in Winter. Hi, everyone.
Hello.
Good to see you all again in this cold, cold weather.
Freezing.
Yeah. And I think good time to start talking about that. All feet are in boots and socks, and nobody's taking them out for others to see at this time.
Yeah, people, they're hidden away, so they kind of forget about them.
Yeah.
Which is probably not a good idea.
Yeah, you think, well, I don't need to look fancy. I don't need to have a pedicure because I'm wearing sandals, but apparently we need to care.
We do need to care.
Yeah. So we're going to get into that today with Dr. Bree. But before we start, I want to say happy belated National Black Woman Physician Day.
Thank you.
Thank you.
We are merely 2.8% of the physician workforce. So I'm very fortunate that I could call 6 more of you, my good friends and colleagues here in Buffalo. And really happy that we get to do this work together.
Me too. I love it.
Absolutely.
Well, let's get into it. So, Dr. Wilson, tell us, as our expert in-house, tell us why health of feet matters in winter.
So, like we were kind of talking about earlier, people generally don't pay attention to their feet in the winter. We're worried about keeping them warm, layering on socks, layering on boots. It's negative. It was -8 this morning. So you're doing our best to try to keep them warm. And then in the same breath, we neglect them. The winter especially is very drying. And so when you neglect your feet, you may wash them, but if you're not properly moisturizing them, it can lead to like little cracks in the heel, or what we call fissures, which for a diabetic patient can be bad because those little cracks, our feet are not in the cleanest places, right? So when our feet have these cracks in them, they can lead to infection. But for someone who doesn't have diabetes, they can hurt, because I've had patients recently where they get these really deep cracks in their heels because they're just so dry. And so one of the biggest things is just making sure you're keeping your feet clean, dry, but also well moisturized.
Yeah. I've never seen a little kid with dry feet. Is it something that happens with age?
So for most little kids, their feet are pretty sweaty. And so, as we get older, for some, our feet don't hold as much moisture as they do when they're a kid. That's very true. Most kids don't have that issue. Usually it's when they get a little older, maybe they start playing sports and things like that, it becomes an issue. But you're right. Most kids don't seem to have that issue. It's just when it's just when we become adults,
why is it so hard for me to keep my feet
because you are a
moisturized?
doctor and you're working on lovely patients, and we're not taking the time to take care of our feet. I mean,
Well,
I've even been a little bit guilty of it myself. So like my birthday was a couple weeks ago, and I got a pedicure.
Happy belated.
Thank you. And I was guilty. My heels were a little dry.
The
The lady who was doing my pedicure, she was like, "So have you been putting lotion on your feet?" I was like, "Nope, kind of stop at my ankles." So I should probably practice what I preach, right? So yeah. One of the things, and I have this poster in my office, and it talks about proper foot washing. You would be amazed by how many people's minds are blown about like how you properly wash your feet, right? Number one, when you take a shower, the clean water from your body doesn't just magically go to your feet and wash clean them. People think this. That does not happen. You must take a washcloth and wash your feet and in between your toes.
Okay.
Then you have to thoroughly rinse them and then dry them. So drying is super important. Drying your feet, drying the heels, dry between the toes. Okay, because if you don't do that, it can create too much moisture. So it's like a perfect balance, right? So too much moisture can create athlete's foot, which can create little fissures in between the toes. And then if it's too dry, again, you can get fissures in your skin. And then properly moisturizing, putting lotion on your feet, on your heels. You can put lotion between your toes, but you have to make sure it's properly absorbed. Like sometimes people just put lotion in there and then they just leave it. Like you moisturize them, like really everything fully absorb, you have to rub it in. Okay. And that way you keep a good, healthy balance with your feet. So if you start to do that now, you know, once spring and summer come, your feet won't look like you've been playing in flower all winter.
So you said lotion. Is there any type of moisturizer that's better than a lotion versus a cream versus an oil?
Right. So I think that if we talk about diabetics, I like specifically Gold Bond Diabetic Foot Cream. It's really super moisturizing. But another one that I usually recommend is Bag Balm. You ever heard of Bag Balm?
Yep, no.
It's an old school salve. It comes in a green tin.
Yes.
It's more like an ointment.
Okay.
Super moisturizing, but it's better than like Vaseline. Like, you know, especially Black people, we love Vaseline and baby oil, right? That don't always work.
Vaseline would be the go-to.
I mean, it's better if it's great if you have nothing else, but I don't think it's the best and most optimal, you know, a moisturizer that can work. I think Bag Balm is great. Bag Balm, green tin.
Okay.
It's like a yellow, very thick, hydrating ointment. It works really, really well.
And bought right over the counter.
Yep, you can get it at any pharmacy.
What about some of the things that you do for your heels?
Like a pumice.
Right.
Yeah.
So usually what I recommend for patients that have like dry skin, like cracks in the heel, soaking your feet, number one. Outside of bathing, soaking your feet once a week, warm water, not hot. A quarter cup of Epsom salt and a quarter cup of baking soda. For 10 minutes, at least once a week. Then after that, a pumice stone is perfect. You can just use that it'll help loosen up any dead skin. It's always better to use a pumice stone on wet skin than dry skin. Okay, because you can get more off that way. And you don't have to get really aggressive with it either when it's wet. It'll just come off. The thing that I hate is the nacho cheese grater thing.
I love those.
Please
the
don't
long
use
ones.
those.
Okay.
Yes, it looks like a cheese grater.
Yeah.
It's hanging in my shower.
It just looks like it gets everything off.
Yes, and then some people get too aggressive. And then it creates breaks in the skin, and then it can create sources of infection. So, and I really think, I don't like them. That's my personal opinion. If you're going to use them with caution. But I personally feel like cheese graters are for cheese.
Yeah, we'll listen to you. You're the expert.
I feel like they're for cheese, not your feet. Pumice stone is the best way to go. And if you're consistent with doing the soaking, at least once a week, you don't have to do it every day, but at least once a week, moisturizing every day, you're on the path for beautiful feet for the summer.
Okay. And Breeann, what did you say? Half and half of what?
So quarter cup of baking soda, quarter cup of Epsom salt.
Okay.
In like a tub of water or like one of those foot soak things. A warm water, not hot. And again, that's mainly specifically for people with diabetes because sometimes they can't feel and they want to feel the heat and sometimes end up burning themselves because they can't feel how hot the water actually is.
Gotcha. Talk to us about toenail fungus. So we talked about dry skin, cracked heels. Sometimes you could get fungi as a result of poor foot care. Tell us about that one.
So I tell people fungus is naturally everywhere. Sometimes if you have a lower immune system, you can pick up fungal infections. If your feet are sweaty all the time, you can pick up fungal infections. You can pick up fungal infections maybe from getting a pedicure at a place that maybe was not really clean. I am not someone who's against getting pedicures, but I don't advocate for like gel nail polish or acrylic on your toes because again, you're taking a bath, you're taking a shower, that water is on your feet, and sometimes it can get trapped underneath that. And so it's just like the perfect breeding ground for fungus. I can't tell you how many women come in, and you know, most women, when they get a pedicure, they just relax, they're chilling, they're not really paying attention until like maybe the third or fourth pedicure, like 4 or 5 months down the line, and they look at their toe and they like, what is that? And so they've developed a fungal infection. And so fungus is, when you see fungus in your nail, you may notice thickness in the nail, discoloration of the nail, or the nail might be really crumbly. So there are a lot of ways that we can treat fungus in a nail, just depending on the severity. For the most part, fungus in the toenail is mostly cosmetic. It's not like the fungus is gonna creep into your bloodstream and create all this havoc. But again, for people with diabetes, if they have those and I've seen like nasty, thick fungal toenails that are like sitting this far off the nail bed. When you have that thickness pushing against the shoe, pushing against the nail bed, it can create a sore underneath the toe. So in that instance, that's when like a fungal nail can be, you know, not a great thing, and you know, maybe something that needs to be addressed sooner. But for the most part, depending on how bad your toenail fungus is, it takes 9 months to a year to clear up. Yeah, because it's as your new nail grows out, you know, a nail grows from the bottom up. As that new nail grows out, it grows out without fungus. So some of these things that you see on TV, oh, you'll have clear nails in 2 weeks.
Don't believe the hype.
Don't believe the hype. Unless you have this like really, really superficial, like just beginning, like you just saw it yesterday kind of fungus. It's not going to work, right? And so there are different treatments that we can do for fungus. Typically in my office, I do a topical or an oral, but some other offices do like laser treatments. There's other things that can be done, but again, it's going to take about 9 months to a year for that nail to fully clear out and be normal.
Okay, good to know. I definitely resonate with I've done many pedicures. I actually don't know what my toenail looks like. You just go from one to the next,
It happens a lot,
You go in, they take it off, you put on a new coat.
Yeah, you just tell them what polish, you're not really paying attention because you're relaxed. It happens so often where I'm like, so
it's really important that we also examine and look at our toes and make sure that they look well. We're not seeing those discolorations. The nail isn't thickened. What about, sometimes folks may have these little ridges on their toes. What's that? Is that related to fungus?
So sometimes it can be fungus. Sometimes people can have like a psoriatic nail from something called psoriatic arthritis. Sometimes it could be vitamin deficiencies that you can get, you know, the ridges in the nails from as well.
So I think we're just trying to say that, you know, looking at the health of your toes is important too. Don't ignore your toenails with your pedicures or just with life. Like spend some time examining them.
Yeah, and your toenails shouldn't be painful either. Right, and so something else that people like to do, bathroom surgery, ingrown toenails.
Yes.
I'm so guilty of that, but this is why I do what I do now.
So
as a kid, I had an ingrown toenail, and I decided I was going to deal with it myself.
And how did it turn out for you?
Great.
Oh,
I'm like, yes,
that is
I'm
not
going to be a
PSA
surgeon.
to anybody else to do that. Do not. I repeat, do not try to take care of your ingrown toenails on your own.
Do not do this at home.
Do not do this at home. But yeah, ingrown toenails are not normal. So, excuse me. If you feel like you're getting an ingrown toenail, number one, they can be caused from too tight shoes, cutting your toenails too short. And then that combination alone, especially with us being in boots and being in tighter socks all the time, you know, that it's creating the perfect storm for an ingrown toenail. And it's important to try to catch it early, because if you catch it early, then there's less invasive procedures that can be done in the office in order to get it to grow out normally. Sometimes you get people who get ingrown toenails and they consistently get them. Then, you know, sometimes you have to do things a little bit more invasive to try to prevent them from continuing to get ingrown toenails.
Okay. Good to know. Good to know.
I like the idea of inspecting your feet, because we, as OBs, we're always saying, you know your breast, how they look, how they feel to you. And I just thought of, I've had 1 or 2 patients who actually have melanomas that were found in between their toes. And I'm sitting up here going, well, that's not getting a lot of sun. So,
No.
Right.
yeah. But
And
then-
unfortunately, when you find melanoma in a foot, for some people, it can be, pretty terminal, especially in the African American community, because it's so rare for us to have melanoma. And when we find it in the foot, it can be, Bob Marley is a perfect example. So, when patients do come in, I do advocate, especially diabetics, and I can't harp on this enough. I advise patients with diabetes to just check their feet every day. Just look them over real quick. It doesn't have to be anything strenuous, but look them over real quick. If you can't see the bottom of your feet, get a mirror and just put it on the bottom and just look at the bottom of your feet real quick.
Okay.
You're looking for any open cuts, any discoloration. Again, it was -8 degrees this morning. Gangrene can set in just like this from frostbite, and it's happened. And so you want to make sure why is the tip of your toe purple? You need to look at it because, again, you can't feel it. And so you need to inspect your feet every day. But again, to your point, everybody should check their feet.
Yes.
Check them for moles. I have patients come in, I'm like, did you always have that mole? Most of them are like, yes, I've always had that mole. But it's something you want to always check, because if it starts to change color, if it starts to get bigger, if it starts to change in any way, it should be biopsied right away, especially if there's a family history of any type of cancer, especially skin cancer.
Okay.
It's a lot of good information. It's real easy to forget the feet.
It is.
Yeah.
It's kind of like out of sight, out of mind.
Yeah. Thanks for this.
You're welcome.
As we talk about toe fungi, athlete's foot is another version of that. Tell us the difference and how to avoid getting athlete's foot. And if you do have it, how do we treat it?
So athlete's foot can come from the same type of fungi that can come from nails. And it's kind of hard to say. Sometimes patients will have both, and it's kind of hard to say what came first, the fungus in the nail, the fungus in the skin. The patient may know, they may not know. But again, it's keeping the right balance in your feet and in your shoes. Washing your feet every day, changing your socks every day, drying your feet in between your toes every day. And the other thing I recommend is, if you do have particularly sweaty feet, like spray deodorant, it's an antiperspirant, spray that on your feet. That can help prevent your feet from being sweaty. It can also help with smell, right? And then the other thing I recommend is spraying out your shoes once a week with Lysol. That'll kill any fungus, that'll kill any mold, that'll kill any viruses that may be living in your shoes. Especially if you only have a couple pair of shoes and you're wearing them pretty routinely. Once a week, spray those out.
Okay.
All right.
Do you know those little balls that they put in the shoes for odor? Does that help at all with just
I think it
drying
helps
out?
with odor. It can help drying out odor, but if you still have the
Sweatiness.
the bacteria and the fungus and everything still living in there, it's just going to come right back. You got to treat kind of the root cause of what's going on.
Yeah.
And what's your opinion in this? I'm just using you as, let me ask about all my
Sure.
personal issues. I have very cold feet.
Okay.
So somebody told me you could buy heated socks, which I just purchased yesterday. Tell me. I haven't worn them yet. They haven't arrived yet. But tell me, what are your thoughts on that?
So again, I think with someone who does not have diabetes, it's probably okay. The problem would come with somebody with diabetes who's trying to feel the warmth. And my concern would be burns, them burning themselves and them not knowing it. I remember having a patient once, it was cold, and he was using, sometimes we use the stove, especially Black people, we use the stove to help warm things up, but he was sitting in front of the stove with the stove open.
Oh dear.
And he got burns on
And he
his
didn't even
feet,
know.
and he didn't even know it because he was completely neuropathic. His nerves were pretty destroyed from his diabetes, so he couldn't feel. And so, I think it's great for, again, people without diabetes, but if you have diabetes, you just have to be so careful and so
careful, yeah.
cautious. Yeah.
All right. So I'll tell you how my heated socks go. My feet are struggling in this weather. So we had talked about, tell me the name of the cream again. We said the Gold Bond.
And Bag Balm.
Bag Balm is the other one.
Mm-hmm.
I see some listings of urea.
Urea is really good. Yeah, urea is really good. It's like an emollient, and it'll help, with dead skin, and it'll help break up skin. It can come in different percentages. insurances sometimes cover, sometimes don't. I feel like over the counter, you probably can get maybe up to 30% urea over the counter. And that is a really good cream that you can use as well.
Also.
Yes.
Good. Lactic acid containing moisturizers.
Yep, those are pretty good too. All Ammonium lactate, that's pretty good as well.
All right. It's good to know. So I think we've talked about most of the things we needed to talk about today. Any final things you'd like our audience to know about how to best take care of their feet in winter?
So, the other thing about winter, most people are a little more sedentary in the winter. So trying to be as mobile as possible, even if it's just stretching every day. Another thing that I always see, especially around January, because it's after the holidays, right, is people are hosting, they're entertaining, they're cooking, they're decorating for holidays, and they're doing all this in socks or barefoot. Yes. And so around January, February, they come in with what? Heel pain.
Oh, yes.
Right, so they come in with plantar fasciitis. And usually it's from being more sedentary, and then going from being sedentary to being more active, which is most people are doing around the holidays in their houses, and they're doing it barefoot. So usually what I recommend, especially around the holidays, is Crocs. Like, I like Crocs as a house shoe. I'm going to say it again, as a house shoe. It is not a great everyday shoe to be wearing, to be doing your job, but I think it's a great house shoe because it has a decent arch support. But stretching is super important, and really staying as active as you can, even in the winter months. I know we had our last episode talking about, our resolutions and how to keep those up. You got to stay active, and your feet are your foundation. Yes. And so if you don't keep them moving, keep them mobile, it keeps you out of commission. If your feet hurt, you don't want to move, but you got to keep them moving. You got to stretch. Stretching your calves is like the biggest thing that you can do. Even if your feet don't hurt, it can help prevent your feet from hurting in the future, because a tight calf can really wreak havoc on a foot, especially the heel.
And it's so easy too. You just do like 30, point and extend, point and extend. And it's wonderful, especially like before bedtime is my big stretch time to like soften everything up before I sleep. And those 30 flex and point of my feet, and my feet up the wall. Like, so I'll put my legs, I should say my legs up the wall, and it just like drains everything, and it just releases all of that tension in your muscles, and gets that blood flowing back through those valves. So it's a wonderful thing. 2 minutes, legs up the wall.
Yeah, those are really good too.
One last thing I forgot to ask before. As you know, it's extremely cold. What type of socks should we be wearing to stay warm, but not necessarily cause fungi or other problems with our feet?
So, I mean, you really want to wear cotton socks, because that'll give you some breathability and some warmth. Do I recommend 3-4 pairs? No, but if you're a person who's like outside, catching the bus and things like that, and you need to stay warm, then that's what you need to do. Now, when you get to where you're going, maybe take 2 pairs off.
Wool socks?
Wool socks are fine as well. As long as you don't have any, like, I can't do personally wool stuff. It just
maybe itchy or
sensitive.
Irritating.
Yeah, it can be irritating. But wool can work well for a lot of people as well. Your boots, making sure they have good grip on the bottom, and that they're well insulated, and that they help prevent your feet from getting wet. I know Uggs can be popular, or that kind of shoe, but they are not insulated. They get wet, and your feet get wet. They don't have a good grip on the bottom either, because I tell you, I took an L myself once, just walking and boom, fell right on my knee, wearing some Uggs. So, just making sure you have on a good pair of supportive boots that have good grip on the bottom, that are well insulated, is also very helpful. And avoid staying outside for too long. That's really the best, especially in these sub-zero temperatures, like 20, 30 minutes, like max. You really shouldn't be out there long shoveling. I know we have a lot of snow, and I know people want to get rid of it, but especially if you have diabetes, either pay somebody else to do it or do it in small batches.
Yes. All right. Well, thank you so much, Dr. Wilson, for keeping us on our toes about foot health. And we want to say thank you guys for tuning in with us yet again. The information shared tonight on Healing with Her is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare professional with any questions you may have regarding your health. The views expressed by the hosts and guests of the show are their own and do not necessarily reflect those of their institutions or their employers. So thank you again, Dr. Teresa Rush, OBGYN, Dr. Breeann Wilson, podiatrist, Dr. Pamela Reed, internal medicine physician. And this is Healing with Her.